Good morning and thank you very much for joining us. I am Yori Falani alongside Asukwa James, TVC News editor.
Good morning, Mr. Yori. Good morning, Nigerians.
Indeed. And today we're listening to the latest briefing, update from NCDC, and the Minister of State for Health, Dr. Mamora, was indicating that healthcare facilities are beginning to run thin. Now, no surprise, because the numbers, even as our people are saying that, yeah, we're recording some successes, the numbers keep on ascending. So right now, as of this morning, as of 9:52, almost 10 o'clock this morning, now we're talking about 389 new cases, and that's bringing pan-Nigeria cases to 8,700.
733.
And 33, and 254 deaths. Of course, but in leaps and bounds, the numbers in Lagos are horrendous, if you get my meaning. Now, Lagos, total numbers in Lagos, around 4,012, and then 256 is the number. What's that 256? What? The increase. The increase. The daily increase. 256.
That is the highest so far.
That's the highest so far.
Yes, for
and that's
Lagos.
a problem. Ogun State has just one, by comparison. Lucky them.
And don't forget, one of the states that claim that they don't have confirmed cases, Kogi, finally had 2 confirmed cases.
I don't like how you said that. As if to say,
I
don't like how you said it.
And that is because they just did one sample test.
Okay, the point you're making is that if you test, it's very likely that you'll get results.
And why we are having these high numbers in Lagos is because they have really gone ahead to test so
Because
many
I was listening to the minister, and in fact, we shall be, the commissioner, and we just might get an opportunity to hear him. I don't know, but I think he said that they've increased the number of tests to around 2,000?
2,000 or so, or
2,000
a day.
a day.
If you don't do the testing, you won't know the
figures.
People,
Okay, so we're going to be looking at what this will bring about, the healthcare capacity running thin, and we're happy to have, as always, our friend Dr. Madeli Boyo. He's a public health expert, and he'll be joining us via Skype. We also have, will be, speaking with his colleague there, Dr. Tui Mebawandu, a public health practitioner. Good morning, doctors.
Good morning.
Good morning, Dr. Mebawandu. Good morning, Dr. Omadeli Boyo.
Good morning.
Okay.
Good morning.
Now, we're going to come back and we'll be talking with you about the challenges that we can begin to expect with healthcare capacity beginning to run thin. We were just hearing, you might have heard us speaking in there, where the numbers are as alarming as they are. Now we have, we're talking about 200 and how many deaths, Azukwa?
254 deaths.
254 deaths across the country.
Yes.
And, the increase in numbers in Lagos, the highest in a long, long while, 256. So what we're going to do, we're going to take our Femi Akande. He has a report, I think.
Yes.
So we'll take that report, give us some background, then we'll come back and we'll continue from there with the 2 contributors that we have.
The next phase.
The Presidential Task Force on COVID-19 returns to their daily briefing after an unusual Muslim Eid al-Fitr celebration. The task force reports that there was a substantial adherence to health advisories against the spread of the virus. Although the number of confirmed cases continues to rise, countries in Africa are experiencing a low rate of transmission, fewer deaths, but measures must be taken to respond to the worst-case situation. This response would be the scramble to find a cure for COVID-19. Nigeria may be closer to getting a homegrown solution to this global pandemic.
We have received a few proposals for local remedies for the disease, and these have been forwarded to relevant agencies for evaluation. For a preparation to be approved for use in Nigeria, it must be subjected to safety, toxicological, and efficacy tests.
The Presidential Task Force is also worried about the plight of children whose education have been disrupted by the outbreak of coronavirus. But they insist that there is no hurry to reopen schools until it is safe to do so.
Until we are sure that these children can go to school, return safely, and not bring home with them this COVID material, then infect people who are more susceptible to the disease than they are, then we are running a huge risk.
Health authorities are now escalating fears that the country's health infrastructure would soon be hit terribly by the spreading pandemic if treatment centers across the country are not urgently expanded. Again, there are emerging new studies that are being considered as the novel virus continues to unravel.
There is an urgent need to expand our treatment centers across the country. I therefore call on the state governors and philanthropists to take active and deliberate steps to scale up the number of beds for isolation and treatment of confirmed cases in their states.
Studies have now shown, using this PCR test, in addition to something we call viral culture day to day, that the longest viability period of the virus is about 10 days.
As more Nigerians in the diaspora are waiting in line to be evacuated to their homeland, the federal government also explores all available avenues to accomplish this task. The latest returnees are Nigerians in Lebanon. The Minister of Foreign Affairs says 50 of this batch are girls trafficked to Lebanon.
Express our thanks to the government of Lebanon for helping to facilitate this, and also the Lebanese community in Nigeria who actually funded the cost of the flight and cost of hotel for the 50 trafficked girls.
Gradually, the country moves closer to the easing of restrictions and reopening of the economy. There is now a heightened expectation from the Economic Sustainability Committee set up by the President to help the country withstand the threat of COVID-19 on the economy. Femi Akonde, TVC News, Abuja.
Okay, thanks to Femi Akonde there. That report went out earlier. And as we were saying, Asukwa, we, across the country, as we're sort of trying a phased, sort of reopening of society, reopening of business, the numbers, we haven't even done that yet, but the numbers are going up. And we've discussed this in the past that, look, there will be consequences. It's about how we manage it. But then this Minister of State for Health there was alerting that healthcare capacity actually is running thin. He's actually appealed to state governors to see what they can do. Maybe I should put the question to our doctors. Dr. Boyo, if I could start with you, this is a very worrisome situation. The indication that we might be overtaken by the number of admissions that are required, so much so that we're beginning to look at other options, including might all cases, confirmed cases, not need to be admitted? If they are mild enough, can they be handled at home? Dr. Boye, would you like to start, please?
Thank you very much. Yes, I'm hearing you. Thank you very much. Yes, I think we are even underrating the situation. We're not approaching a period where the hospital beds are not available. We are past that period. There are no beds again. Isolation centers are full. I lost my cousin last week, Monday. I lost another cousin this Sunday. COVID-19. Isolation beds are not available. May their souls rest in peace. Now, the issue here is that the isolation centers are full. The general hospitals don't have beds right now as I'm talking to you now. Maybe they may have beds reserved for some purpose that we don't know. I'm a private medical practitioner, and I can tell you some of the things going on. But what we have seen now is that we have been stretched beyond limits. The government of Lagos State is trying all its best, but the truth is that we have been stretched beyond limits. So right now, if you have COVID-19, the first thing is, like you said earlier on, we're looking at the statistics together. The truth here is that what you are saying on paper is far, far, far less than the reality on the ground. Why? We are not testing enough. By 2 weeks ago or so, we had 5,000 specimens awaiting testing. The labs have tried, have reduced the testing. See, if you are going to test and you have to deal with the backlog first. Lagos State reported 2-something yesterday. 132. Let me get my figures straight. 132 or so. And the problem is that Lagos State is not testing the way it was testing about a month ago, because of many issues like what we call the having specimens. Yes, the samples coming, but the reagents were not available. So as at yesterday, Lagos State had 256. If Lagos State were to test fully and test as many people as should be tested, not should be underlined, not as many people as want to be tested. If Lagos State should test people that should be tested, and they have the capacity to, these numbers will become much more than this. But what we have now is 256. So the question is...
Actually, Doctor, that's down from 11 o'clock yesterday when they were reporting 375. When NCDC released the figures at 11:30 yesterday night, it was 375. As of this morning, 8 minutes to 10, they now have 256. So it sort of came down a bit.
Yes. No, it's not going down. You see, the point, Mr. Yori, it's not going down a bit. What is going down is testing capacity. It's not the people reporting with COVID-19 that is going down. If you don't test for a whole day, you report zero. Okay?
Yeah.
Now, Kano has not reported much. They're not testing. It's what you test, you report. Now, if you've not tested for a whole day, you report nothing every day. That's why Kogi was reporting zero. And that's why Lagos is reporting a lot, because Lagos is doing more testing than other states. But even then, with a city like Lagos of about 18 million people, the tests we are doing today is still very, very minimal. So it's not the fault of the government. It's a lack of reagents, and also we have a huge number of people compared with limited facilities.
Okay, Dr. Mebaodu, what danger does it portend, Dr. Mebaodu, if you can hear me? What challenges will it portend that the idea that if the symptoms are sufficiently mild, we can, begin to look at the option of treating at home as outpatients? Is that the right expression? How is that going to work? Because we've been thinking or hearing that for the treatments to be to be good, people need to be isolated. So how are you going to be isolated at home?
Thank you, Mr. Yori. It is a difficult situation. I am telling you, whoever has to consider that must be able to back it up with science. Now, look at Lagos. Let's look at the population and the house density of Lagos. Lagos has as much as 2.5 million housing deficit. More than 60% of Lagosians are staying inside the slum. The infrastructure, about the water you need to wash your hands, the soap, and to go, not just there. Inside a single room in those slums, you have 10 people, 5 people, 7 people stay. Tell me, now by the time we have moved to the community transmission now. The community transmission is not worse in those slums. How do you now isolate somebody in a slum, in a single room, where there are 5 people, where there are no water, to wash hands, where there are no hygiene processes.
Okay, one moment, Dr. Mebaudu. I beg your pardon. I beg your pardon, Dr. Mebaudu. Thank you very much, sir. I got to go on a break now, but stay with us, please. I'll return to you as soon as we come back from the break. Stay with us. Okay, welcome back, and we have Doctors Tuyi Mebaudu and Amadeli Boyo. We've spoken with Dr. Boyo. We'll be returning to him, but I had to interrupt Dr. Mebaudu to go on a break. So, Dr. Mebaudu, you were, speaking on the concept of treating sufficiently mild cases as so determined perhaps by doctors at home and the challenges.
Yes, it's a huge challenge, okay, because number one, you have the protocol for teaching at home must include one, the caregiver, the patient, the community, and even the health system itself. Now, if you are going to define such protocol, it means that the person who is going to do the caregiving at home must be sufficiently informed to identify what is a mild case, what is a severe case or very severe cases. These are core issues. The person who is supposed to treat at home must be able to practice personal protective equipment, which must be available at home, and understand how to clean the person, how to prepare food for the person, and how to identify when the case has moved from mild to moderate or severe. That is key. You must be able to have access to clean water to do washing and soap. Now, there must be isolation also. If the person is staying in the slum, 60% of Lagos State of Lagos residents are staying in slums. And you see, you can see more than 5-10 people inside a room. How do you practice social distance in that case? How do you assure hygiene? How do you ensure hand washing?
So what you're saying, doctor, is that it's a humongous challenge. I think the points you are making, sir, is that it's a humongous challenge to do what has been said. Dr. Boyo, Dr. Boyo, would you like to also air, your impressions on the challenge of that idea? But, I mean, I don't know what's the way out. We hear that patients are being not turned back, as it were, because of what you've just said, Dr. Boyo, if you're still with us, that there's a scarcity of beds now.
I'm with you. Yes.
Dr. Boyo, can you hear us?
The truth of yes, I can hear you very clearly.
Okay.
I can hear you very clearly. Yeah, the truth of the matter, like I said before, is sincerity of purpose. People, I mean, there's nothing like isolating yourself because if you have mild symptoms. The truth of the matter is that isolation itself is defined as separating sick people that are sick with a contagious disease from those who are not sick. I repeat, separating people that are sick with COVID-19 or Ebola from those who are not sick. Even hospitals can have isolation wards. Now, when you say you are separating people, you are telling people to go home to isolate, self-isolate as they call it, and you call the disease mild. One, has it been tested? Once the person is COVID-19 positive, in fact, the people at home will run away from him. As I spoke earlier on, I've lost 2 persons in a week. Yes. And both of them are relatives that bear the same name with me. I'm not talking about a distant person. And I've had cause to even bury one of them myself. Now, the question is this. Once somebody is COVID-19 positive in Nigeria, people run away from you. 2, self-isolation, I mean, go back to your house. Stay in a different bedroom. Use separate bathroom. Use separate dishes, separate glasses, separate utensils, separate towels, and everything. And when people want to give you food, they don't enter the room. They drop the food by the door. And you take the food and you eat. And you return. You don't go out in the compound. You don't go to your next door neighbor. You don't use the same bathroom that everybody else is using. Now tell me, where does this work? Like Ikoyi and like not here where we are. So at the end of the day, I practice and live in Oshodi local government. Now you can imagine that the majority of the houses here, even when they are flats, they are face me, I face you rooms. And you have like 10 rooms on the right, 10 rooms on the left upstairs, 10 rooms on the left, 10 rooms on the right downstairs, and there are 2 toilets and 2 baths. And I'm going to practice isolation like what my colleague said. Under such circumstances, where will you have separate bathroom? So we send people to go and buy salt, and we pray that rain should fall. If you are telling somebody to go and do isolation, he doesn't have the capacity to self-isolate. You have to have a separate bathroom. Now you say, oh, this Africa, that is luxury. That's luxury. Where also here in public health, like my colleague will tell you, there's what is known as knowledge, attitude, and practice. People are now sufficiently aware of the negativity of COVID-19 that there's a stigmatization.
Okay.
Even when people come to the hospital, with our own private hospitals, we have what they call mutual suspicion. The patient thinks it doesn't have it. The hospitals are afraid that the patient have it. Talk less of you get to your compound today and your wife tells people that, look, we want to separate the bathroom for you children that is COVID-19 positive. Straight away, everybody wants to do coronavirus tests. Let me round up with this. Our tests are not accessible, available, affordable, and done for anybody that needs it. We will continue to have this problem. My suggestion is, if you are COVID-19 positive, with or with no symptoms, you should be isolated. Thank God Lagos government has moved further from the isolation centers. They've done a lot. They've taken some hotels now. They are taking some hotels now to use as isolation. The truth is that the population is overwhelming.
Indeed.
And the government right now cannot cope, except more donations of more hotels, more donations of stadia, donations of churches and mosques that can be used for this. If not, we are in trouble.
Okay.
I don't know whether it's the two doctors.
Okay.
Yesterday they said something about non-pharmaceutical strategy. I don't know if that one will work in any way. The Minister of State was saying something about non-pharmaceutical strategy. How will that one work?
Dr. Omeba,
I yield to my colleague.
No, yes. to you, Dr.
Okay, you want to yield to Dr. Boyo?
Hello. If he's available, let him talk.
Okay, Dr. Tui.
No. I'm talking. Dr. Boyo, let me condolence of you can now feel what it means to lose. Now, the big problem is this. The big problem, we're pushing a lot of challenges and falsehood on social media. I can't agree less that the whole healthcare is under an intense pressure to look for cure for coronavirus. You see what is happening on the hydroxychloroquine test. Whereas WHO said that, we're not seeing any good evidence on the hydroxychloroquine. Whereas Nigeria said, okay, we are going to continue with the test of hydroxychloroquine. In fact, the method that the what they call solidarity trial that WHO is doing is strange to most things. Another trial is what we know. They want to shorten the time. They said solidarity trial. Even the solidarity trial is solving the problem. And they stopped it. Nigeria said, well, we're going to continue with our own randomized trial. We'll look at the data, it will be peer reviewed, and we'll check. Having said that, now all this challenge of trying to find to be careful. We should not create false hope. We should not start creating false hope and then cause more problem for ourselves. What we need to do, what the government needs to do essentially, is to deepen advocacy, is to ensure prevention. People wear face masks, be careful, avoid crowds. Those are the things to do. And when you look at the whole spectrum of health system, the health system has the government health system and the private health system. And then government has chosen to engage in treating COVID-19 alone. They are not involving other external health systems. What I mean by private health system? Lagos State has barely about 1,300 doctors. That's alone. And they have more than 2,500 private health systems, including hospitals, clinics, pharmacy, and co. They are not involving them. Advocacy, they are not involving them. Testing, they are not involving them. Counseling, they are not involving them. Contact tracing, they are not involving them. So again, how do they think that they can do all the work by themselves? I have said initially that government needs to take all the stock of what they have, both private, public, and everybody, and see how to really run through the whole spectrum so that it can benefit anybody. Anybody looking for a shortcut or one that goes or one is just playing game. As far as I'm concerned.
Dr. Tuyi,
There are
Dr.
specific
Tuyi,
things that science has to say.
Dr. Tuyi.
Science is about thinking. Now we have to speak.
Dr. Tuyi, if you can hear me, are you saying that?
I can hear you.
Okay, are you saying that the Lagos State government had not even reached out to private hospitals, at least for you guys to have a collaborative effort to see how this can be handled or tackled?
I think it might have frozen.
Because they made a statement there. That
Dr.
was
Boyo,
I'm just trying to.
Are you hearing us?
Yes.
Okay. Maybe you could take the question.
Let me tell you, I should know very well if there's that kind of
okay.
reach out. Now,
I think there was a delay. I think Dr. Mebaodu has heard the question now.
Hello?
You can go on.
Please go on. Go on, Dr. Mebaodu.
I'm hearing you. Now, when the TB cases
there's a bit of a problem.
Hello? I've got the question. Now,
okay.
when the TB cases in Nigeria was getting too alarming, when the malaria was too alarming, there was a desire to involve private hospitals in tracking TB cases.
Sorry, Dr. Mebaodu, I'm going to have to... Let me go on to Dr. Boyo, because we have a problem. The network is not quite favorable in your side. Dr. Boyo, in the meantime, could you also please pick up the question? Asuku was asking the extent to which governments such as Lagos, for instance, since that's where both of you are practicing, might have engaged with, the private sector, private medical practitioners. And I wonder if Dr. Boyo's network also didn't just go out.
Power shortage. They will change the generator.
Oh, okay. So go ahead, since we can still hear you.
By the government. There have been an attempt by the government to collaborate. There have been attempts.
Okay.
But the problem is always too little, too late. Piecemeal, because there's mutual suspicion. The government believes that most private hospitals may not be able to handle this. They think that most private hospitals are incapable. Meanwhile, these private hospitals have been inspected, registered, and continually monitored and evaluated by the Lagos State Ministry of Health. So the question is, the government has decided to bite more than what it can chew. In more developed countries, they even use private hospitals as isolation units. Since most private hospitals have private wards with toilet and bathroom and TV, and they pay them. Now, the government is not willing to spend money on private hospitals because they look at private hospitals as business concerns. In spite of that, 70% of the inhabitants of Lagos use private hospitals. Only 30% go to the private primary health care centers and last and loot. So we need to also orientate that. Now it's good it has happened. The government is now choking and is choked because at the end of the day, it's having more than what it can cope with. Now, when malaria became a problem, when TB became a problem, like my colleague was saying, foundations like you said, in multilateral organizations like you said, foundations like Bill and Melinda Gates Foundation, Dangote, they all started engaging private practitioners. The engagement of private practitioners in TB, tuberculosis, family planning, and other things has helped to bring down the scourge of the disease. The Lagos State government is willing, but it's not been able to draw traction on it, full traction. The private hospitals themselves have to also be ready. So there have been a series of seminars held by the state government with the private practitioners, webinars, Zoom and everything, telling the private practitioners to be on the lookout for COVID-19. That's separate. But they have to be the ones to buy their PPE, buy the masks, buy everything. And what will happen if a COVID-19 positive person is found in a private hospital? Be shot down. Why? They say we are not safe for biohazards.
Biohazards. Okay. So forgive me, I got to interrupt you again because I've got to go on a break, Dr. Boyo, but I'll be right back. Please stay with us. Okay, welcome back. We have our doctors on the line, Dr. Tuyi Mebaodu and Dr. Madili Boyo, but I suspect that Dr. Mebaodu's line is proving a bit troublesome. But Dr. Mebaodu, is it any better? Can you hear us now?
Very clearly.
Oh, very clearly.
clearly.
Okay, I think I've decided what has happened. I think it's a matter of there's the delay, and the delay is worse than in the case with Dr. Boyo. But nevertheless, since we understand you, well, Dr. Boyo had really taken the question when it seemed that your audio had frozen about the efforts of government in that regard. So let me just go on to the other aspect of it, which is that it seems that we're in a very serious, I wouldn't like to use the word mess, but we're in a dire situation here. What are the ways out? The Minister of State for Health, Dr. Mamora, he was calling on governments to, and other philanthropists to donate more. Is that what we're reduced to now? Is that all that we can do? Because this is a problem.
Yes, maybe
okay.
Here. All right. Yeah, well, maybe I can come in here.
Okay.
We are doing what we can do.
Dr. Tuyi.
Dr. Mebaodu, go ahead if you can.
Can you hear me?
Yes, we can hear you. Please just continue, Dr. Mebaodu.
Okay, now, listen, when COVID broke out, we had a whole month to prepare. When our own case came, we were not actually prepared. We now start throwing water at the fire. We just want to kill the fire. Now, what has happened essentially is this. The whole spectrum of healthcare, we must harness because, number one, you are in a country where you have just 35 doctors per 100, where you have 12 pharmacists per 100,000, where you have a maximum of 80 nurses per 100,000, where the beds available is just barely 50 per 100,000, the hospital beds available. The whole number of ICU in Nigeria is not up to 300. The whole ICU in the whole of Nigeria is not up to 300. So it's a mess. So if you look at that kind of situation,
ICU, intensive care units.
Yes, the whole of Nigeria is not up to 300. Now, if you have that kind of situation on your hand, the best thing is to see that let me harness every health person, every health personnel in this country. Let me help them. Let me standardize some things. Let me ensure that they can, even if it is testing and advocacy and contact tracing they can do, let them help me to do it so that I can free my own health system. If you push this thing on health system, it will collapse. That's a fact. So the cheapest thing for us will have been to deepen our prevention method. That will be the cheapest. If we're not going to get that, we need to pick every part of the health system and say, what role can you play? Like we said, we have done it with TB, we have done it with malaria, with HIV, we're doing it. So why can't we repeat it with COVID and some other health intervention?
Okay.
Some of these private hospitals are local. They stay within a locality, and they can do a lot in their locality and help government. But is government engaging them? Can government do it alone? No. So, even if we choose to open a lot of isolation center, a lot of treatment center, you need human resources for health to man them. To give resources for health to man those people. It's not just about the building. If you put the building there and the requisite human resources for health are not there, you get your high fertility rate.
Okay, one moment, please. One moment, Dr. Mebaodu. Returning to Dr. Boyo, the severity of the problem, it can't really be overemphasized because, on the one hand, you were talking earlier about the need of advocacy, Dr. Boyo. I couldn't agree with you more because there also is the complication of asymptomatic cases, we call it. That is to say, people that don't show any symptoms but are still able to transmit. So I fear that just as you were saying that we're taking false, comfort from the unreasonably low numbers, which are as a result of not being able to test, in the same sort of way, might we not be, taking false comfort in the fact that people who are imminent dangers to us, but are not exhibiting any symptom whatsoever, are close to us, and so it's really become a mess. And here we are opening up society again. So it's really a very complex mix, Dr. Boyo. We have to be very careful how we manage this, no?
Mr. Ayori, it's not a complex, it's a simple mix made complex by people. Because at the end of the day, my colleague said everything. Testing. Then we go to tracing. This is not rocket science. If we cannot even test, and the government tests and finds people positive, and they involve the private. In Lagos here today, there are at least 10 private hospitals to 20 that have facilities that are superior to what you have in teaching hospitals anywhere in this country. Now, what is wrong in collaborating with them and strengthening them? I'm not saying they should use private hospitals to treat COVID-19. No, let's start with tracing. Somebody that they found in Oshodi, Mafoluku area, positive. Alert the private hospital around there to see what they can do. Isolation. There are many ways you can collaborate. But you see, when government thinks of collaborating, they think of money. They want money. No, it's not money. Tracing only needs you knowing where the person lives, find out other people he has associated with. Every local government in Lagos, as what they call it, medical officer, is the Minister of Health in the local government. He knows all the hospitals there. If you collaborate with the local government in the area with the private hospitals, just a simple area of testing and tracing. Once somebody is positive, the medical officer of health alerts the medical director and the medical directors of the private hospital in that area that, look, there is somebody positive here. What can we do?
Okay.
Even these private hospitals can be occupied. Like during the war, factories were taken over by government. Private hospitals can be paid something, and these beds can be taken over by government, and government can lift up the standards of those hospitals to be able to even admit COVID-19 and get the nurses trained to take care of COVID-19. Instead of going to use hotels, why can't we, for instance, approach private hospitals that have 4-story buildings empty and say, look, you have the capacity, just do isolation for us. Go to this place, do isolation for us. Then tell the younger ones, the smaller ones, can you do contact tracing with your local government primary health center? And they are cooperating. Listen, we're not talking about hydroxychloroquine. We're not talking about antiviral. Just testing, tracing, and the 4 things my colleague mentioned: hand washing, face masking, social distancing, and then keeping yourself safe. If you can do those things, listen. Anywhere in the world where they practice I call it physical distancing, really. Where they practice physical distancing, masking, wearing gloves when necessary, physical distancing, masking, and then washing of hands.
Yeah.
Any society that can practice these ones,
I hear you, Dr. Boyo.
Better than investing money in hydroxychloroquine.
Indeed. And okay, first of all, we're opening up the lines, so you can call in from home too, please, if you wanted to add to this conversation. And let me now ask the other question of Dr. Omebawadu. Really, it's for both you doctors, and I hope the lines will cooperate. Dr. Omebawadu, how happy are you, so to speak, with how we are observing those 4, points that Dr. Boyo just, recapped on that you mentioned? The social or physical distancing, the hand washing, the masking, and all of that. I say this, and I want to also throw into the mix there the danger of asymptomatic cases, where people that are not sick, who don't look sick, but still are live, so to speak, in terms of being able to transmit the diseases. Are you happy that we are taking it seriously enough to be really paying the utmost attention to those 4 pillars that you were speaking about? Or are people sort of leaving it all to their religion that they are covered and nothing bad will happen to them?
Sorry, we lost this. We mismanaged information. We are not dispensing information as it used to be. We're now at the stage of misinformation and disinformation. Up to today, I think I was driving a few nights back, and the police officer asked me, "Is it true that there was a lot of doubt, but we need to manage the information well." You must do that way past. If marriage, why should their place of worship be open? There's a lot of doubt. We didn't deepen the communication and information system appropriately. We didn't involve the stakeholders. The religious leaders are stakeholders, the traditional leaders are stakeholders. We didn't inform them. So we lost information. Right now in Nigeria, there's a huge lot of doubt. If you go on social media, you see all sorts of videos trying to, discredit government attempts at informing social media, because again, at the point in time, government refused to engage a lot of stakeholders. You know that religious leaders, for instance, they have their own followership. What aspect of prevention and advocacy did you give to them? You know that traditional leaders have their own crowd. What aspect did you give to them to manage in terms of advocacy and information to their own subject? We lost it. So now here we are. People that chose to practice this are people that have a first-hand experience, like Dr. Boyo now, who had lost two of his relatives. He will understand that really COVID-19 is real. So, and for us, the emphasizing the matter that wash your hands. But cooperation at those three levels is just marginal. What people are doing now, you see them putting on face masks. It's either a chin mask now, a chin. They put the mask on their chin. Exactly. It's a chin mask, not face mask again. Yes. They just want to do that just to go out and please government. They are not doing from the depth point of the fact that we are protecting our health, we are protecting the health of other people. It takes a lot. In fact, the amount of misinformation going on social media is humongous. It's huge, and it's tough. Now, at the level of the federal task force on this COVID-19, they must have to re-engage people. They must re-engage the people. If they continue with this trajectory, what we are going to get is that more people will have the disease, more challenge on the health system, and then we'll keep talking what we are going to do. But Nigeria wants to open up their country. Well, you are on your own, so protect yourself. That's the best I can say.
Well, in that regard, Dr. Boyo, I was reading in the papers this morning that even as we're trying to open up our societies, Dr. Amadili Boyo, even as we're trying to open up our societies again, I think the authorities say, one paper this morning, this day newspaper, the lead is that government is actually now considering two shifts option for reopening of the schools. And I think you heard on the report we led with, you heard the Minister of State for Health saying that it was only when they're in no hurry to open up those schools. It's only when they're absolutely sure that the kids won't bring back any infections that they will do so. So any way you look at this, it's a necessary danger. We know that there are going to be consequences, but again, people are saying that, well, the consequences are going to be perhaps much more uncomfortable from not opening up our society than coronavirus can inflict. The damage that such would inflict will actually be worse than what coronavirus could do. So it's like between the devil and the deep blue sea. We're looking for the better alternative. There's no best alternative in this situation.
Yes, thank you, Mr. Yori. If I may add to the first topic on COVID-19 positive asymptomatic individuals, the answer to that is testing. Because if you are asymptomatic and you have not been tested, we are going to see you as one of us. You are going to be free to move around spreading the disease. But once you have been tested and found positive, you are supposed to isolate 14 days.
But how, Dr. Boyo, sorry to interrupt you, Dr. Boyo. How does, Dr. Boyo, sorry to interrupt you, how does an asymptomatic patient or person get tested? Since doctors are saying, don't come and overwhelm the system by having headache, you come here. So if a person is looking and feeling good, he's not going to go for testing.
Yori,
how does that work?
Doctors are not saying don't come and overwhelm. It's the government that is saying. The government is saying don't come and overwhelm the system. Testing is not done in a place. If you want to do revamp testing, you have to have all the centers, all your local government. It's not treatment centers like Yaba Mainland, like Lutz, that you go for testing. You go for testing in a nearby place, maybe at your samples are collected at the local government primary health center or some hospitals, private hospitals in the area. So people are tested for three reasons. One, have you come, like now, I said my cousin died recently. The government should be pursuing me. Even though I never saw him, I cannot tell, we never saw, it was on phone call. I was directing on phone call until they were buried. I never saw him physically. But once you've had contact with a COVID-19 positive person, If you have symptoms, which is what you mentioned, you can be tested. But there are so many reasons why we can do contact tracing. We can do testing because we want to know the real figures of the asymptomatic COVID-19 people. If we do that, we separate the wheat from the chaff. We now know that these people are positive, move them somewhere. But the government seems afraid of that too, because that in itself has its own implication. What do we do to the positives of that when we don't have space? So if the government, like you said, is torn between the deep blue sea and the devil or the rock and the hard place. So let's not do too much testing, because too much testing will raise alarm. By the time you do testing in Lagos and find out we have 20,000 people in Lagos that are positive, 100,000 positive, 200,000 positive. Even you will move to Abuja. I'm telling you, you will move your station to Abuja.
Or look for a place where the figures are good. And I think right now, yeah, I don't know. In Ogun State, there was only one case reported yesterday.
You start doing TVC this day from home. We'll now see you in a bunker in your house, like one bunker broadcasting to the world. That's what will happen. Now, because we are now living in a fool's paradise without testing. So I want to repeat this. Testing. No school should open. No place should be allowed. Look at, I went to the police station the other day to relieve. They arrested my lab scientist, and they said he was breaking coffee. He was going home at 8:30. I went to the police station. Can you believe that? No physical distancing there. Even if you see a police van on 3rd Mainland Bridge going somewhere, you will see 15 policemen crammed at the back of a jeep. Is that physical distancing? So what my brother and I have been saying, my colleague and I have been saying is, before all this testing, all this hydroxychloroquine and then agbo, ginger, and then physical distancing, hand washing, and the face mask. If we can do these three, do them to the letter like Sweden did, we're not getting the point of doing so. Wait, physical distancing, hand washing, masking, and then testing. What we're not doing testing and tracing. Are you getting me? We can now know teachers that are coming to open schools must have COVID-19 tests. Parents who are coming to school must have COVID-19. Why? I won't send my child to a school where I don't know the status of the teacher in class. And the teacher in the class is afraid because teachers, older people are more susceptible and more vulnerable. So the teacher is afraid of the children bringing the COVID-19 to her.
Yeah.
So we cannot open schools until we revamp testing and make sure that as many Lagos State with 20 million people should be testing at least 100,000 a day. Anywhere.
No, Lagos just announced that. 100. No. But 100,000.
Lagos is the federal government that is saying that they now have reagents for them to test 100,000.
Lagos State has to test 100,000 people a day, and we're about 26 or so local government. How you do the CDAs? If each Lagos State Council Development Area can be testing 10,000 every day, wow, we'll get there. Indeed. Then after that, we now enforce physical distancing in the like now you are talking to me here. Before you ordinarily have come to pick me to your studio.
Yes.
Now you are talking to me here because of physical distancing. Now enforce that in the market.
Is the new
our markets are not malls like in the US and Europe.
Yes.
Our markets are very, very well, there's deep contacts in our markets. Our markets are not malls. Now we open Sangros, open Tejojo, open Mile 12, open Oyinbo, and we are saying physical distancing. We cannot deceive ourselves. And those things are more important than hydroxychloroquine, that drug from Tanana Reef, you know. That island next to Africa. And we're talking about all these things.
COVID organics.
We don't need all those drugs. And these are drugs that we need at the treatment centers, ventilators, treatment centers, in high-tech hospitals. What we need every day, physical distancing, water hand washing, masking, and testing and tracing. If we can do this, we'll find out that we lower our death rates. But to not do them, why we not do them? If we do COVID-19 testing everywhere, we now find out that we cannot isolate. Why can't we isolate? Separate bedrooms, separate bathrooms, dishes, eating utensils. We cannot do that. And I tell you, go to Ajegule, go to many parts of Lagos. We cannot really do isolation, except the government comes in. What am I suggesting? Government should, for a small token, take over some private hospitals with a huge number of floors, provide beds there, and they have a gift at the end, maybe a ventilator, or maybe they have some things for them, and they can release the hospitals for isolation.
Okay. Well, Dr. Mebaudu, I understand the situation of your network, but I know that it'll pick up subsequently. Oh, and for those of you at home, we have opened the lines, but it's also raining, so I don't know if that is affecting the GSM networks and that kind of a thing. But actually, we do have the lines open, and we haven't received any call yet. Sometimes it's like that. But Dr. Mebaudu, it's
Now, can you,
it's
yes,
it's a
I'm hearing you.
it's a calculated kind of strategy. We know that in opening up for businesses, especially the kind of markets we have, we don't have malls. We don't have Ikeja City Mall, as the majority markets. We have Oyingbo, we have Sangros, we have Mushin, we have Ojuwoye. Those are the kind of markets we have up and down the land. So it's certain that the numbers are going to go up, and we've been told that we have a finite number of beds. So it looks like it's going to get gloomier anywhere we look at it.
That's what it is. So if we're candidate testing in that scale, what we can do is to look at what we call a cluster testing. What is a cluster testing? Now, maybe I find myself somewhere in Makoko or part of the Italewa, and I found out that there are about 6 cases of COVID-19 there. All I have to do is look at that cluster test and take it on that level. Now, if I find that there's a school, somebody that if a teacher has COVID-19 is COVID-19 positive, I can do a cluster testing. The cluster testing will do because we are finding out that the cost of testing the PCR test is about 50,000 naira. That's a lot of money per test. So we need to deploy a fast test. Now, look at, for instance, let me give you an example. Emirates, they are deploying what they call a quick test to check people that actually are flying, and the test is about 10 minutes. It's about 10 minutes to get it done.
Okay.
Why can't we deploy a kind of quick test that will tell us exactly where we are, and then from there we can then do confirmation tests. So we can do this thing.
Okay. Sorry, Dr. Mebaudu, we're running short on time. I beg your pardon for interrupting you. We really are running short of time. These are desperate situations. In fact, we're even hearing that doctors now are thinking of discharging patients, COVID-19 patients, after one negative test. You know, before we used to hear about two negative strikes,
but now it's
now
one.
at one, it's okay. You can go and just take good care of yourself. I think what I can do now, the only thing I can do right now is just to thank you, Dr. Omadele Boyo. We've completely run out of time, so I don't want you to start another. I won't ask you another question, so you won't start an answer. And also to express our deep appreciation to you too, Dr. Tuyi.
A very brief.
Indeed, Dr. Tuyi Mebaudu, our public health practitioner. Thank you as well, sir, for your time and, as it were, giving us to understand a bit better the scope of the situation that we are in. Okay, well, please, it's not very, very cheering news. We'll keep an eye on it, see how it all goes, and we'll stay on this story. Please join us tomorrow for a fresh edition. And so from us, Sukwa James and I, stay safe and see you tomorrow, God willing.